Beyond the trip, beyond the haze, we're lighting up these shadow waves. Ketamine dreams to...
Welcome back to Conscious Healing, Beyond the Trip, hosted by Dr. Jason Harris. Each week, Dr. Harris explores the world of ketamine and other psychedelics, uncovering how they're helping to treat mental health conditions and chronic pain disorders.
This podcast is intended for educational purposes only. The information shared should not be considered medical advice. Always consult with your physician or a qualified healthcare professional before making any changes to your medication or treatment plan. Please be aware that some of the substances and treatments discussed on this podcast may be illegal in certain jurisdictions. We do not endorse or encourage the use of illicit substances. Welcome to Conscious Healing Beyond the Trip. I'm Dr. Jason Harris, an emergency medicine physician with a passion for exploring the therapeutic potentials of ketamine and other psychedelics. In this podcast, we dive deep into the medical, psychological, and transformative aspects of these treatments. Whether you're a seasoned practitioner or simply curious about alternative healing methods, join me as we uncover the insights and stories that go beyond the ordinary. Today, we're diving into a crucial, yet often overlooked aspect of psychedelic medicine, the profound influence of set and setting. As psychedelics move closer to mainstream therapeutic use, understanding these concepts isn't just helpful, it's essential for anyone considering or undergoing these experiences. So what exactly are set and setting? It sounds a bit like an interior design term, doesn't it? But in the context of psychedelics, it refers to a powerful duo that can largely dictate the nature and outcome of a psychedelic journey. Let's break them down. Set refers to your mindset. It encompasses everything you bring to the experience internally. You should always consider the following when planning for a psychedelic journey. Intentions. Why are you engaging in psychedelic medicine? Is it for healing, self-exploration, spiritual growth? Having a clear intention, even if it's simply to be open to what arises, can provide a valuable anchor. Expectations. What do you anticipate? While it's good to be open, unrealistic expectations can lead to disappointment or resistance. Conversely, fear or intense anxiety can contribute to a challenging experience. Mood and emotional state. Are you feeling anxious, depressed, curious, calm? Your current emotional landscape will profoundly influence how you perceive and process the experience. Personality and beliefs. Your personal history, coping mechanisms, and worldview all play a role. Someone with a history of trauma, for example, might need a different level of preparation and support than someone primarily seeking self-exploration. Physical state. Are you well rested? Hydrated? Have you eaten appropriately? Your physical comfort and well-being are part of the set. Prior experiences. If you've had previous psychedelic experiences, positive or negative, these will influence your current set. Think of set as the internal compass you bring to the journey. It's about your readiness, openness, and your psychological foundation. Now, let's talk about setting. If set is the internal, setting is all about the external environment in which the psychedelic experience takes place. That includes physical space. Is it safe, comfortable, quiet, and aesthetically pleasing? Are there soft blankets, calming colors, or neutral elements? A chaotic or distracting environment can amplify discomfort. People present. This is arguably one of the most critical aspects. Are you with trusted, supportive individuals like trained facilitators or therapists? Do you feel safe and unjudged in their presence? Having a skilled guide who can offer reassurance and navigate difficult moments is paramount, especially in a therapeutic context. Atmosphere. Is the energy calm and conducive to introspection? Is there appropriate lighting and sound? Some prefer silence, others gentle music, and some even find a benefit in nature sounds. Legal and ethical context. While we're discussing this in the context of emerging therapeutic models, it's crucial to acknowledge the importance of a legal and ethical framework for safety and accountability. Preparation and integration. While technically pre- and post-experience, The plans for preparation and integration are part of the broader setting. How will you prepare for the journey, and how will you process and incorporate insights afterwards? These are crucial supports built into the setting. Imagine trying to meditate in the middle of a bustling train station. Your setting would be incredibly challenging, making it difficult to achieve a deep state of introspection. The same principle applies, perhaps even more so, to psychedelic experiences. Why are set and setting so incredibly important in psychedelic medicine? Firstly, they significantly influence the safety and efficacy of the experience. A supportive and secure setting combined with a prepared mindset can help minimize the risk of distressing experiences, often referred to as bad trips. It doesn't eliminate the challenges, but it provides a framework for navigating them constructively. I got a story I'm going to tell. I had a patient that came in one day. We were treating her for PTSD from a car wreck. On her way to the clinic, she almost had a car wreck. Somebody pulled out in front of her, and they almost got into a wreck, which just shook her to the core, because here she is trying to get better from her PTSD from her previous event, and she almost has a car wreck on her way in. She was visibly shaken when she got to the clinic. We had a discussion, asked her if she wanted to cancel her treatment because she was so upset. She said no, she'd be fine. She wasn't. She had a bad trip. It was negative for her because she kept bringing back what happened on the first wreck, and it was just amplified by her previous. So, in retrospect, we should have canceled the treatment. We should have let her go home, process, and then come back on a different day. But she chose to move forward, and we did have to give her some medicine to relax her. So, it is significantly important to have that good mindset. Secondly, set and setting contribute to therapeutic potential. Psychedelics don't just magically fix things. They act as amplifiers, opening up a new perspective and insight. It's the work done within the context of a well-prepared set and setting, often guided by a therapist, that leads to lasting change. The psychedelic itself is a tool, set and setting are the workshop. Consider a patient undergoing psilocybin-assisted therapy for depression. Their set might involve a strong intention to address their emotional pain, coupled with a willingness to confront difficult feelings. Their setting would be a comfortable, calming room with a highly trained therapist present, ready to provide support, guidance, and help integrate the insights that emerge. Without this careful orchestration, the experience could be overwhelming or even re-traumatizing. This leads to a crucial point: integration. Insights gained during a psychedelic experience are often fleeting if not properly integrated into daily life. A good setting includes a post-session support structure, therapy, journaling, group discussions that allows individuals to make sense of their experience and to translate it into meaningful behavior and psychological shifts. It's where the insights from the trip become the actual progress in your life. So what can you do to optimize set and setting? Whether you're considering psychedelic medicine or just want to understand it better, for set, intention setting before any experience, even if it's just a meditative practice, take time to clarify your intentions, write them down. Self-care. Prioritize good sleep, nutrition, stress management in the days leading up to the significant introspective work. Emotional preparation. Engage in practices that help you feel grounded. Meditation, mindfulness, spending time in nature, or connecting with loved ones. Education. Learn about the substances you might be using, its effects, and potential challenges. Knowledge can alleviate anxiety. Therapeutic support. If you're considering psychedelic-assisted therapy, ensure you have a trusted therapist who can help you prepare mentally and emotionally. For setting, choose your environment wisely. If you have control over the physical space, make it as comfortable, safe, and free from distractions as possible. Think about lighting, sound, and comfort. Select your guides or companions carefully. In a therapeutic context, this means working with licensed, experienced professionals. In other contexts, it means being with people you trust implicitly, who are sober, and who understand how to provide empathetic support without judgment or interference. You don't want your trip sitter to be high also. Minimize distractions. Turn off your phone. Inform others to not disturb you and create a bubble of focus. Plan for integration. Understand the work doesn't end when the effects wear off. Have a plan for how you'll process and integrate the experience afterwards. This might involve journaling, talking to a therapist, or engaging in creative expression. It's important to stress while set and setting are powerful, they are not foolproof. Psychedelic experiences can be unpredictable, and even with the best preparation, challenging moments can arise. The goal of optimizing set and setting is to create the best possible conditions for a positive, therapeutic, and insightful experience, and to provide the necessary support to navigate any difficulties. As psychedelic medicine continues to evolve, the understanding and meticulous application of set and setting will be paramount. It's what distinguishes recreational use from responsible therapeutic engagement. It's what allows for deep healing and profound personal growth. Before we go, now for a quick update on psychedelics in the news. Advances in psilocybin trials. Science Biomed recently announced that the expansion of its clinical trials for natural psilocybin. The trials are being conducted across multiple states with a focus on treating alcohol use disorder. This development includes partnerships with Southern Star Research and aims to better understand psilocybin's therapeutic potential. Patient enrollment is set to begin soon, marking a significant step forward in psychedelic research. A link to this article will be posted down below so you can find out more information or read more about it. Stay tuned next week for our next episode where I will discuss PTSD and its treatment using ketamine and other psychedelics. This podcast isn't medical advice. It's a conversation, one that's evolving. So talk to your doctor, ask the hard questions, but remember, your provider might not be up to date on the latest research or might be closed-minded to the use of psychedelics, even though the science is there. Stay skeptical, but stay open-minded, because sometimes the most important healing paths are the ones nearly forgotten. Thanks for joining me on Conscious Healing Beyond the Trip. I'm Dr. Jason Harris. Until next time, stay curious and stay informed.